Surgical gowning steps. With one hand, pick up the entire folded gown from the wrapper by grasping the gown through all layers, being careful to touch only the inside top layer, which is exposed. Once your hands are securely pinching the gown in these slots, step back from the shelf and allow the gown to drop. Make sure the gown does not touch any surrounding unsterile objects. Grasp the inside shoulder seams and open the gown with the armholes facing you. Carefully insert your arms part way into the gown, keeping hands at shoulder level away from the body. Slide the arms further into the gown sleeves. Be careful that no part of the hand protrudes from the sleeve cuff. An assistant will fasten the gown behind you, positioning it over the shoulders by grasping the inside surface of the gown at the shoulder seam. The assistant's hands should only ever be in contact with the inside surface of the gown. The next step after gowning is to don some surgical sterile gloves. Surgical gloving. Open the inner glove packet that you previously dropped into your sterile field. Pick up one glove by the folded cuff edge with your sleeve-covered hand. Place the glove's rolled cuff edge at the seam that connects the sleeve to the gown cuff. Grasp the bottom rolled cuff edge of the glove with the thumb and index finger of the hand the glove is on top of. While holding the glove's cuff edge with one hand, grasp the uppermost edge of the glove's cuff with the opposite hand. Using the now gloved hand, put on the second glove. Check to make sure that each gown cuff is secured and covered completely by the cuff of the glove. Adjust the fingers of each glove as necessary so that they fit appropriately. Keep your hands in your sleeves so that you do not touch the glove on the outside of the gown with your bare hands. Keep your hands above your waist and in front of you. Ensure you do not touch anything around you that is not sterile, and these includes your face, mask, and cap. The simple interrupted suture. Loading the needle. To begin, the first step is to load the suture material and your needle in the needle holder. You hold the needle at the junction of the distal 2/3 and the proximal 1/3 of the needle. This brings stability to the needle and your movements. After loading the needle, lock the needle holder so that your needle remains fixed and stable. To start suturing, the first step is to gently lift the skin with the forceps. This allows you to visualize the wound and the skin properly and plan your entry and exit points exactly. Pierce the skin surface with a needle at a 90-degree angle to the skin. The needle should not be tilted as it may lead to a more superficial or deeper entry into the wound. Keeping the needle at a perpendicular angle allows your movements to be precise and accurate. The entry point should be 4 mm from the wound edge. Pass the needle. The next step is to pass the needle through one side of the skin of the wound and make it rise out of the middle of the wound. To do this, you have to use a curved motion of your wrist that allows the curved needle to easily pass through the skin. As the needle rises out in the middle of the wound, use your forceps to hold your needle as you release your needle holder. Grab the needle again with your needle holder. The next part consists of passing the needle in a similar style of motion through the opposite edge of the wound. To do this, lift the opposing skin edge gently with the forceps to visualize the wound properly. Pierce the skin in the middle of the wound and, using the same curved motion of your wrist, the needle travels perpendicularly through the dermis from inside to outside. Use the forceps to grasp the needle and stabilize it until you hold the needle again without the needle holder. Tie the knot. Using your needle holder, pull the suture material through the wound, leaving a 3 to 4 centimeter tail behind. For the final part of tying the knot, the first step is to make 2 loops of the suture material around your needle holder. Then grasp the tail end of the suture material with your needle holder and pass it in between those 2 loops of suture that you just made. This is your first knot. Move your knot to the side of the wound so that it doesn't lay directly over the wound. After this, make 1 more loop of the suture thread around the needle holder. Again, grasp the tail end of the suture and pull it through the loop that you just made. This second knot imparts stability to the sutures and ensures that the knot won't open up spontaneously. Pull both ends of the suture with your needle holder and trim the suture about 1 to 2 centimeters in length. It is important not to trim the sutures to a very short length, as it makes removing the sutures very difficult after a few days. Surgical knot tying. Surgical knots have a wide variety of uses in surgery, and knot tying is an essential skill for every surgeon to know and to be competent in. Pick up the end of the short thread with the left thumb and ring finger, with the remainder of the thread passing over the left index and middle fingers. Pick up the end of the long thread with the right thumb and index finger. Bring up the long thread with the right hand to align next to the short thread. Using the left middle finger, whilst still holding the end between left thumb and ring finger, pass the short thread under and then over the long thread. Pull the right hand upwards and the left hand downwards, allowing the knot to rest in position. Adjust the tension of the knot as necessary. Come back upwards with the short thread by holding the end with the left thumb and index finger. Pick up the long thread with the right thumb and index finger and bring downwards to align next to the short thread. Repeat the same maneuver as before, passing the short thread under and over the long thread. Pull the left hand upwards and the right hand downwards, allowing the knot to rest in position. Adjust the tension of the knot as necessary. Repeat the same maneuver as before, with the short thread facing upwards and the long thread facing downwards. Adjust the final tension of the knot as necessary.